This is the final session for today, the penultimate day of BPM Open House 2014. Linking different organizations into a process can be difficult. However, the benefits are immense. In this presentation, you'll learn how BPM approach to coordinating the work of different organizations, cases, and people can improve efficiency and outcomes. You'll discover the methods and tools. You'll discover the methods and tools used for the patient care process and find out how the toolkit can be applied to your business needs. Here to provide this insight and answer your questions are Mac McConnell, Vice President of Bonita Sauce, Mark Monterostelli, Entrepreneur in Residence, U.S. Department of Health and Human Services, and Ed Daniels, Principal, Blue Margin. Mac is Vice President of Marketing at Bonita Sauce, where he is responsible for all product oversight of the Bonita BPM suite. Mark is currently an Entrepreneur in Residence at the Office of the National Coordinator for Health Information Technology and focuses on developing new tools for data sharing and workflows. And Ed Daniels is Principal at Blue Margin with responsibility for the firm's health IT practice. Before I hand over to our presenters, again, I'll go through my housekeeping points quickly. First, there's time for a brief Q&A at the end of the session. If you do have any questions, you can ask those at any time during the presentation using the text box in the bottom right corner of your screen. Secondly, if you would like a copy of the slides from this presentation, simply send an email to our presenters or to us at PEX Network, and we will happily share them with you. With the housekeeping over the way, I would like to hand the show over.
Great. Thanks very much, Craig. This is Mac McConnell with Bonita Sauce, and I want to thank everybody who's joining this session today. Bonita Sauce had a great partnership with the Process Excellence Network for the last couple of years, and I always, as I interact with their audience, I love it because it's all process professionals and people who are excited about both the art of process design, but also the science and technology of process design. So one of the really fun things about working with Bonita Sauce and our model is that we get, since we're an open source company, you can freely download Bonita BPM Community Edition from our website. We discover a lot of really exciting projects that I don't think we'd be involved in if we were a traditional commercial vendor. And one of the cases is the presentation we're going to be doing today. And working with Mark and Ed, who are doing some very exciting things, trying to apply open source tools and process management to some of the changes that are occurring in the U.S. healthcare industry, I thought was a terrific lens to really present to the audience the real, the power of a business process management suite and some new ways to think differently than the traditional, efficiency benefits, the traditional coordination benefits that business process management suite and Bonita Sauce provide. I think we all need to start thinking bigger about BPM and really how it can improve, improve corporate growth, organizational growth, also in this case, improve patient care, patient health, improve how massive industries can really benefit, such as the healthcare industry here in the U.S. or the healthcare industry anywhere in the United States. And so I think it was really fun when I started working on this presentation with Mark and Ed, and really they're the stars of the show because they're the ones that have configured Bonita BPM and other tools to really create a working process application for a set of organizations that they're working with in the New York City area. So, the fun is learning about what people are doing, and so that's all I really have to say. I really want to get into the use case and the tech, and so Mark, I'm going to hand it over to you to start.
Thank you, Mac. Good afternoon, everybody. My name is Mark Monterostelli. I am the HHS External Entrepreneur or Entrepreneur in Residence at the Office of the National Coordinator of Health IT. And I'm on a one-year term sponsored by the Secretary's Office on basically a detail to ONC. And I wanted to explain a little bit about what the Office of the National Coordinator is all about before I introduce Ed. So the Office of the National Coordinator was established in the Bush administration as the kind of clearinghouse for developing electronic capabilities for managing health records in the United States, and was really launched in a wide way when the HITECH Act was passed as part of the President Obama's stimulus package in 2009. And the Office of the National Coordinator became the key place where electronic health records were developed and incented. And as we've seen a lot of use of electronic health records and expansion of electronic health records, we're starting to not see as much advantage as I think people thought. And the problem is that people are not necessarily connecting their electronic health records together. And so the program I was brought in on in a follow-up to a previous entrepreneur in residence named Todd Park was really to help the United States exchange health information records and find value out of exchanging health information records. And what we're going to talk about today is some of the use cases and reasons why health information exchange is important in our discussion with Bonita Sauce. And with that, I'll turn it over to Ed to introduce himself and take us through the healthcare side of this.
Thank you, Mark. I appreciate that. And Mac, thanks for inviting us to participate here. I've been involved in healthcare and healthcare IT for many years. Over the past few years, I've been working with the federal government on something called automated alerting, which is an automated process for notifying a physician when his or her patient has been admitted to a hospital or treated at an emergency room. And also in my background, I spend a lot of time consulting with health information exchanges, and you may not be familiar with these, but they're organizations that exist throughout the United States that are dedicated to facilitating the interchange of clinical information among hospitals, doctors' offices, and insurance companies. And then also I'm a principal with Blue Margin, and we're an IT services company located in Fort Collins, Colorado, and our goal is to help implement the products that we're going to be talking about today with healthcare companies around or organizations around the country. So now I'd like to talk a little bit about the healthcare situation and the environment that makes this product that we're going to be talking about make so much sense. And one thing when you're talking about healthcare that I think is important for you all, when it seems like we're just talking about a theoretical business issue that's not really relevant to the particular industry that you're in, well, it's always important to remember that, of course, we all have personal experience with the healthcare industry. It might be our own experience personally if we were ill or we had some type of a medical issue. It might be our children or having a baby. It might be our parents, but we all have exposure to the healthcare system. And it's important to know, and it's not always obvious for those of us who are on this call because we're probably, relatively speaking, among the privileged, if you want to call it that America has a healthcare problem. The entire world has a healthcare problem, but the U.S. specifically spends roughly twice as much per capita on healthcare as most other developed nations do. And in 2012, the United States government spent more per person on healthcare than all but 2 other countries in the world. So significantly, with this kind of spending growing, the United States has to make some changes, and those changes, after years of prediction and forecasting, are beginning to take place. And we'll talk about that, but I just want to say from a personal perspective, after my long career in healthcare, and Mark likes to tease me about that, but you know, I've been in healthcare since IT was really initially applied to healthcare. Now is the time of the greatest change in the U.S. healthcare industry that I've ever seen. And there are a number of forces driving that change. One of them is just the fact that medical knowledge is increasing exponentially. There's a huge explosion in medical knowledge, whether it's in the best practices in treating disease or surgical techniques or genetics. The knowledge explosion is incredible. Second of all, as we all know, because we're in the IT industry, IT capabilities are now significantly more than they have been in the past. And finally, in the United States, the mechanism of payment for healthcare services is changing, and we'll talk a little bit more about that. One of the causes or forces that has driven this change in payment is the Affordable Care Act, otherwise known as Obamacare, and Mark just referred to that. But the Affordable Care Act was a significant piece of United States legislation, commonly known as Obamacare. It's about 2,000 pages long. It has about 300,000 words in it, which, just for your reference, that bill is about the size of the largest Harry Potter novel. And so there are a lot of details in that, but one of those elements is driving the reason that we've developed this product in the particular use case that we're going to be talking about, and that is called the readmission rate. So for years, here in the U.S., we've looked at hospital quality, and one of the key measures has been readmissions. When you're in the hospital to have a particular problem treated, and then you get discharged, if you unexpectedly have to go back to the hospital, that is an issue or an anomaly. And so we've measured the percentage of times that that has occurred and used that as one of many measures of hospital quality. The less readmissions, the higher the quality level. And one of the incentives that was built into the Affordable Care Act is a financial penalty for hospitals if a patient is readmitted. Now, the specific math of that penalty is too complicated to get into here, but specifically it covers readmissions for heart attacks, heart failure, and pneumonia. And I've included here, for those of you who are interested in the slides, some reference to these facts, and so you can always dig into that further if you're interested. Mark, do you want to go to the next slide, please? So historically, then, these readmissions that are unexpected back to the hospital have been a problem, and there have been various clinical and business processes that have been put in place to try to prevent or reduce this from happening, and these all are triggered by the discharge from an inpatient hospital. And the previous speaker, Luis Cortez, talked a little bit about some of the many different complicated things that can happen when a patient gets admitted to the hospital, and he referred to the fact that you have to go look at the billing or registration information. You have to find out if there's a bed available and put the patient in the bed. It's sort of analogous to getting to registering at a hotel. But in this case, we're focused on the discharge side of things. And right now, as amazing as it may seem, most of the processes that work in American hospitals are still involve paper, fax machines, telephone calls, etc. And as I mentioned, one of my areas of study for the last few years has been the fact that a lot of times the doctor doesn't even know when his or her patient is discharged from the hospital. So that makes it very difficult to follow up with that patient and take the actions that are necessary to make sure that they don't unexpectedly end up back in the hospital. So the United States government and Health and Human Services has spent literally billions of dollars trying to help resolve this problem by getting improved medical record systems in place in both doctors' offices and hospitals, and in creating these health information exchange organizations that I spoke of. But those solutions continue to be expensive and not ubiquitous. Not every organization in the United States that's doing healthcare can afford those kinds of systems, and even more so, they can't afford to do the connections or the automation of processes that are necessary in order to make these improvements in quality and cost reductions. So consequently, we were fortunate, myself working on this project with the federal government, was fortunate to have Mark Monterostelli brought on as the external entrepreneur as he introduced himself. And specifically, he was tasked with developing a set of tools that would address this problem. Mark, I'm going to turn this over to you now to talk about what you put together.
Great, thank you, Ed. Yes, so let me try and draw down from the high level what Ed said into why this project, the Basic Encounter Alert Toolkit, came about and its angle for business process management. So from the Affordable Care Act and from the data that Ed talked about, the healthcare system in the United States is very expensive relative to the outcomes. And the purpose of the Affordable Care Act, or at least half of the Affordable Care Act, was basically to lower the utilization of the healthcare system and shift care from expensive encounters inside of hospitals to less expensive encounters outside of hospitals. And what we see today is managing patients in transition from a hospital to a nursing home or to home is extremely inefficient, and recent studies have shown that there's about $25 to $50 billion of wasted spending just managing patients when they transfer. And that's going to get even worse because the purpose of payment reform is to shift utilization away from the hospital. So for example, New York State has a program right now to reinvest $8 billion into the healthcare system there to drop the use of hospitals in New York State by 25%. So even more care is going to shift into the hands of primary care doctors outside of the hospital. And so when you look at the people who are going to be more and more responsible for managing people's care, it's what we would think of in an industry point of view, the middle to lower market people. These are not the big organizations with all of the resources, but individual clinics, independent doctors, small little networks out there that are going to be taking on the increased responsibility to manage the patient's care as they're transitioning out of these encounters. If you also add into the fact that care transitions themselves are long-running processes, right? When you're discharged from the hospital after receiving a cast, we're going to monitor you for 3, 6, 8 months to make sure that everything goes well, that you go to all of your physical therapy visits, that you take your medications, everything is done. You have this sense of long-running process. And so when you combine the need for middle to low market people to manage long-running processes, the result is open source business process management. That's your solution. And in my experience, in the previous company that I founded, Verge Solutions, which was a company that made software that was used inside of hospitals, we were surprised to find little to no penetration of BPM software anywhere in healthcare. And previous to coming to Health and Human Services, I did a deployment of another BPM system, a commercial system inside of healthcare for managing patients who had safety events. So if they got the wrong medication or they got the wrong leg amputated or whatnot, a BPM system would kind of take over and manage how that patient is treated so that you lower your risk of getting sued. And so having that experience and just being surprised how little it was used and looking at transitions of care, it became pretty clear to us that we need to push the industry, the healthcare industry, towards adoption of BPM. And that's the point of this project, is to demonstrate the power of BPM for managing congestive heart failure patients. One other thing that I want to note too is that we've also brought together other technology that's being developed inside of healthcare for doing clinical rules. So basically finding particular patients and particular patients' needs so that we can act on them better with business process management software. And what I want to show in our demonstration today is kind of the cross-section of open source business process management and how we're going to leverage it for these small independent physician practices to better manage their patients. We're going to talk about a specific case study around congestive heart failure, and anytime it comes to talking about something healthcare specific, I'll usually pass it back to Ed. So Ed, if you want to describe, oh actually Ed, one more thing before I say that. I did want to mention this slide, I didn't see this. One of the things in our research that we've found is that business process management software can act as a container for delivering decision support services and integrating networks of people together. And that's a big problem that we have in healthcare. There's a really strong prevalence of federated networks. So you have a doctor and a couple clinics who get together to manage a set of patients, but they're all on different systems. And so we have to provide a way for them to integrate together. And although they have limited ways to exchange data, they don't have ways to pack rules in between those data exchanges to really do decision support and create integrated delivery networks. And so the system that we're going to show you today creates integrated delivery networks out of federated systems by leveraging process modeling, clinical rules, and predictive analytics to help you understand how your patients are going to, what they might do and what they have done in the past. So I'm going to hand it over to Ed to talk about the specific use case we're going to demo today.
Thanks, Mark. So I'm still hung up on that amputated the wrong leg safety event. So excuse me if it takes me a minute to get that out of my mind. But anyway, the specific use case that we were asked to assist with is with an organization called hasnt Medical, which is a practice in the Bronx, New York. And they were asked by their local hospital to look at patients that have a diagnosis of what's called congestive heart failure. And just for your medical lesson of the day, heart failure is an illness in which the pumping action of the heart becomes less and less powerful. And when the heart can't pump as well as it used to, then blood doesn't move efficiently through the circulatory system and starts to back up. And that increases pressure in blood vessels, forces fluid from the blood vessels out into body tissue, and so causes edema, which is, you may have seen people in the supermarket that have the swollen legs or look like they're sort of puffed up, and a lot of times that's due to congestive heart failure. And congestive heart failure is a very serious condition. As a matter of fact, it contributes to 1 out of 9 of all deaths that occur in the United States. So it's a life-threatening condition. So a lot of these patients are admitted to the hospital, and they're treated various ways, mostly medically, sometimes surgically. But once the patient is healthy enough to get discharged, then what happens? And in this case, the hospital was concerned about making sure that the patient didn't go downhill after they were discharged, have to end up back at the hospital. That's both a bad outcome, which of course the hospital doesn't want, the doctors don't want, the patient doesn't want, the family doesn't want, but also it's a bad outcome financially for the hospital. So they invested in having hasnt help them follow up with these patients. And hence this process, which you can see, which was originally done completely manually, and that is when a patient showed up in the hospital, was getting ready to be discharged with congestive heart failure, or missed an outpatient visit, that would trigger an action on the part of the care coordinator in the hospital, and the care coordinator would fill out a form about the patient on paper and fax it over to hasnt Medical, and hasnt Medical would check the patient's insurance to find out what that patient is eligible for, and then contact the patient and make arrangements, if possible, to do a home visit where they would check to make sure that the patient was on his or her appropriate medications, was eating right, was weighing themselves, because the weight of the patient is an immediate indicator of whether they're on the right therapy and whether their congestive heart failure is under control or not. And part of the reason for this, again, not only was the incentive for the hospital to reduce penalties for readmission, but also because an analysis of the U.S. healthcare costs shows that if we could keep even 2% of these patients from coming back to the hospital, that could generate a savings in the U.S. over $100 million a year. So it's significant, but when we encountered this process, it was entirely manual, fax, and written documents, and prompted by the memory of the participants. So Mark, I'm going to turn it back over to you now to explain how we automated this process.
Thank you, Ed. And I just want to underscore that the diagram, the little written diagram here, was provided to us by hasnt prior to them even kind of knowing about how we might apply BPM tools. So let me go to our demonstration here. And first tool I'm going to go to is, so this is the Bonita Sauce BPM Studio community version. This is the authoring environment for process development provided for free by Bonita Sauce through their open source license. And our first step in working with hasnt was to interview them and understand what their process steps were, both what they were doing now and what would probably be a best practice process from the point of view of orchestration. And so this is the process that they're running now. It replaces their a mishmash of faxes and emails, and they were writing all this down in a spreadsheet and doing a bunch of exchanges that way, and orchestrates a set of automated and human tasks for them. So I want to go through a few pieces of this and highlight some of the things that they found fascinating that they couldn't do before, but also highlight some of the features of Bonita Sauce that we thought were excellent when we were reviewing the product. I'm going to start with the first step. So the process gets initiated by a form that's filled out, which is pretty common for a human-started process. And the first step here is a notification. So even this wasn't occurring before. They were receiving referrals on the fax machine and really no way to automatically notify anyone if a new referral came in. So if we inspect this a little bit inside of Bonita Studio, I want to point out that the first thing we wanted to do was get notifications to people, and we used the built-in connectors that Bonita Sauce comes with, and I'm just going to briefly show you the preset list of connectors. There's just a bunch of different connectors you can use here. I may not show this, but later we've used extensively the Google Calendar connector because many of the people that we have to communicate with in terms of doing house calls and whatnot are not authenticated into any clinical system. So the only way we can, so for example, we're dealing with drivers who are driving physicians to different house calls. We can put things directly on their Google Calendar, which they couldn't do before. The drivers right now literally stop into the clinic in the morning and pick up a slip of paper that kind of tells them where they're going all day, so we can automate that. But let me show you some of the first connector we used, which is an email connector, and this was built, this came out of the box with Bonita BPM, and it's just a very quick form that the hasnt team could validate and code in which users are going to receive a custom message. So everything in here kind of, you know, is easy and wizard driven, but also results in a little Java form here or a studio piece that you can write some code to customize your messages and users. The second connector I want to show I think is even more important. So when you're dealing with patients, you're dealing with protected health information or PHI. You cannot just email out to somebody any information about a doctor without risking a big penalty from the federal government. So one of the first things they needed was a way to notify themselves in a secure way. And they have a secure mobile app provider called Curator that all the doctors run on their smartphones for messaging each other. And the idea was, could we leverage that and connect in and message to people? So what we were able to do is use the built-in, I'm going to show you, I'll just give you an example of what this mobile app, how it surfaces to the product, the process designer. They're given an API key, and it literally is just like sending an email. You give it the email account of the user, and the mobile app is very patient-specific or healthcare specific, so you can put in the name of the patient and whatnot. And at that point, it will message that doctor or whomever securely. You can also put in information about the patient, not only their name, but demographics, when they were discharged, anything to get something to someone right away. The way we built this, and one of the advantages to having Bonita Studio is that it is built on top of an Eclipse environment. So we can come into our connectors page and actually build in a custom connector that surfaces to users as a wizard, but allows our developers to come in and let's show it here. It allows our developers to get a sense of any external resources that they're using, and will automatically open an Eclipse-like Java environment, so we can write code directly into the studio. And our development team found this great because it was much easier for them to keep track of all the code they were writing and make it much more specific. The connector set that comes out comes with a lot of pre-built classes to make it very easy to write connectors into almost any other system. We've done several custom connectors now, and we really like that part of Bonita Sauce. The particular connector that we worked on here, the mobile notification connector, was really just a wrapper of their REST API, which is very easy to write. Okay, so the first step is they get some notifications, which was a big win. If we had just ended the process there, we probably would have saved them quite a bit of time and effort getting everyone on the same page. But one of the next issues they had was validating insurance. So when a patient is presented at discharge, we don't know if their insurance carrier or their payer will compensate the clinic for doing a house call. And before we even contact the patient, we want to know that information first to know what kind of services can be offered. What they were doing currently was typing this information into a spreadsheet, and they would save it on a drive, a shared drive, and then on Fridays, there was a woman who would come in, she would open up the spreadsheet and validate, the dozen or 2 dozen CHF patients and validate their insurance. So there would be cases where someone would be discharged on a Monday or Tuesday, and we wouldn't know if they were qualified for a house call until Friday. And as you can imagine, the first couple days of discharge are frightening and scary for anyone. So the sooner that you can contact that family and contact that patient after discharge, the more likely they are to trust you, to be willing to receive a house call, and the more likely they are to call you versus go and call 911 if there's a problem. So getting insurance validated was a very important thing for them to do right away. And so the process immediately tees up a human task for the insurance validation team to come in and validate. So next I'm going to just walk over to the portal here and show you how that happens. So Bonita BPM Studio comes with a portal. We've rebranded it here so that people aren't logging into a bunch of different products, but it's really just as simple as a style sheet change on our side. And the portal allows the users to log in and see the tasks and notifications that have been served up to them and ways to comment and do a bunch of workflow on these tasks. If we look at the validate insurance task here, I have one teed up here, and grab it to do, it will just render a very simple form. This form was designed by the care team at Essen, so the form authoring environment of Bonita is easy enough to use that we were able to train the care managers there to go in and make their own forms, and which they love because it's something they would normally have to hire a web shop to do. So it's a simple form. They call the health, in this case Health First, and they check and see if the patient qualifies for insurance and then submit. And of course that submits back to the server, and now we know whether or not they're valid for insurance through the rest of the process instance. The second form I wanted to show you and to point out a few other features is the call. Let's go to this here. So when we actually get a patient on the phone, let me do this task. They use Bonita BPM to develop another form to help them capture information about what the status of the patient is. So previously they were reading this off of a paper form and writing these notes down. Now they were able to capture some structured information. So you can imagine a question like, are you taking your medications? Now they can answer this, and based on the answer here, they can immediately take action to get this problem solved. So if they're not taking the medications because of a lost prescription, that's a very different intervention than if they're not taking it because they're having some sort of adverse reaction. So the rules after this can pick this information up and get the right intervention, and time is so important in health. If their health deteriorates because of an adverse reaction and they call the hospital and they go back and you don't track that, as Ed said earlier, you just saw a huge financial loss for the hospital. In fact, just to put the numbers around it, a typical 30-day readmission for a hospital costs them about $13,000, and they're not eligible for reimbursement. So if that patient comes back within 30 days, they lose $13,000 just off the bat without any recourse. So keeping them out is very important. The other thing I wanted to mention here is that we were able to code into the form, again, leveraging the connectors to other systems. If they do have an acute problem that the patient senses, we can immediately message the physician for a callback. And so if they do not understand their medication instructions or something like that, the fact that we can message the physician, keep in mind these physicians are spread out through the Bronx doing house calls. So if we can message that physician and get a call back to that patient, not only do we solve the acute problem, but people in healthcare or patients are shocked because that's usually the kind of responsiveness you do not get in healthcare. Usually it's a long wait to get a physician to get back to you. And so they also see increases in patient satisfaction and also better adherence to people's post-discharge care plans by the speed of reaction. And the last feature I want to point out here is we were able to use BPM, Bonita BPM, to also automate the interaction with the physician. So we send the physician some information right now, but the physicians are now trained that when they get the notification on their phone, they can respond back with a couple of code words to get more information. So if they want to know, for example, the patient's allergies, they can respond back to the message with the letters ALL. And we have another process that's using a set of catch events that will listen for that, go back, find the process instance, find the patient, and ship them off a list of their allergies. So the doctors are able to communicate back and ask some basic questions without having to call somebody and figure it out while they're on the road. And when they're out doing house calls, they don't have access to their electronic health record system. So this ability to be able to ask these couple questions and determine what's going on with this patient in an automated way allows them to get to patients' needs much faster. Okay. So the next thing I want to do is I just want to step back to the studio here and explain a couple other BPM events that we're using here to manage the patients. And the next one I want to talk about is this catch message event. So the other problem that we have in healthcare is people don't get notified when patients go back to the hospital. So it's probable that some of these CHF patients are going to, for good reason, go back to the hospital. And so what this catch message event is doing is we have a data feed coming from the hospital that gives us a message essentially when any patient is admitted to the hospital. And we're surveilling that data feed, looking at the patients who currently have open process instances. And if we catch a patient that has been admitted to the hospital, a message will come out and kill any processes that are running for that patient. So in this case, we catch that a patient's been admitted, we send out a couple notifications, but then we end the process. So if that patient was in line for a call or a visit or something, all that gets ended. And you see this a lot in the house calls business. Within a day or two of discharge, we finally get to their house, you know, their daughter answers, oh, Dad went back to the hospital, and we had no idea. They didn't bother to call, and so we just wasted a lot of time and resource scheduling that. So surveilling data for patients to show up in other facilities is an important part of making this a profitable endeavor for SN Medical. Okay. The next thing I want to show you is an integration to another system, our clinical rule system. And one of the things that SN Medical needed to be able to do was ask more clinical questions about the patient during discharge to be able to better inform the process. So this first service task here connects to the hospital and gets something called a CCDA, which is essentially an XML document of all the patient's data. And what we have running, which is another product from Health and Human Services, it's called Tacoma, is a way to run clinical rules on patients when you have these XML documents. And I'll just briefly show you one so you can kind of see what they look like. But this is an interface to an external system that's running clinical rules as patients are moving through a transition of care. I'll show you one of them here, aspirin prescribed at discharge. So this is a rule authored in a language called QDM, which is a clinical querying language that allows you, what it's doing is it's trapping patients, in this case, who had a heart attack, who were over 18, who had a short length of stay, and looking for patients who did or did not get aspirin. So the way we've integrated these two systems together through Bonita is, again, with a custom connector. So what we're able to do is write a clinical rule that's checking to see if the patient was discharged with a prescription for what are called ACE inhibitors, which is a special thing that you need when you're a congestive heart failure patient. And the way this works is we have a custom connector in here, and I'll show you how this looks. It essentially is this simple for the process designer to program in the patient's unique ID plus a unique ID of a specific rule that's in our rules engine. And our rules engine is tied to a CMS service that has hundreds of different rules asking questions about different patients, and it puts them into different populations. And so all we send back to that service is a question: is this patient part of this rule, and are they in this population? And we get back a true false, and that's it. And we're able to then know going forward that that patient has that particular condition. Either they're on that particular medication. We have rules for disease categories. We can ask, you know, is this patient a diabetic who's prone to depression? And if the answer is yes, we're going to take a different route with how we're going to deal with that patient post-discharge. If that patient is a frequent flyer, if they have more than 3 encounters in the last year, we're going to apply a much different set of resources to that patient than if this is their first discharge in years. They're probably unlikely to go back. So being able to clinically inform the business process management system is a key part of making this actually work in healthcare. And I think I'm going to stop there. So that should give you a good sense of how we've leveraged the Bonita BPM studio, the fact that it's integrated with Eclipse, the fact that it's open source, the fact that so many connectors are pre-built in, and it's very easy to build connectors to other systems, that we were able to both use this for transitions of care but also make it interact with a clinical rules system. So with that, I will pass it back to Craig for any questions, or for Mac if you have any other comments that you'd like me to go into.
Yeah, hi Mark, it's Mac. Yep, sorry Craig, go ahead.
No, sorry. I was going to say if you have anything else to add, please do, so please continue.
Well, yeah, no, I just wanted to add, I mean, I think this is, you know, a really terrific, you know, example of how a business process management suite, in this case Bonita, can be connected up to multiple different systems and multiple different organizations. And that's one of the things that we continue to, you know, just learn from our customers as we continue to work with them, that, you know, process within a silo is very easy to manage. Process within across silos within one organization gets a little bit easier. But once you're trying to connect multiple different organizations, and in this case it's hospitals and medical management groups and individual doctors, it becomes very complex. And that's really where a business process management technology can really shine, because it allows you to bring together, you know, basically people, data, and systems into an organized application that should have real benefit. So I've been fascinated watching Mark and Ed build this over the last few months, and really excited to see how it works in the field as they bring more organizations online. So that's all I wanted to chime in and say. And Craig, why don't we hand it back to you and see if there are any questions?
Thank you. Fantastic. Well, we've had a couple in, and as always, we've got time for more. If anybody has any questions, bottom right corner of your screen, feel free to submit them. We'll start with the first one. As you rolled Beat out, what was the biggest technical challenge you had to overcome?
Mark and Ed, I should probably hand that one to you.
Technically, I think the biggest challenge. Yeah, thank you, Mac. I'd say technically the biggest challenge is protected health information. So because of what a special rule passed in the Clinton administration called the HIPAA Privacy Act, creates a lot of penalties and very specific privacy rules about how patient information is moved around. And so at every step of the way, people ask that question all the time, like, how do we know this is secure? How do we control who sees what information? And fortunately, BPM is perfect for that, because it's based on rules. It's based on exactly that, letting people get the information they need at the right time. So a good example of a response to that was the validate insurance task. So we're now able to serve up to a person who's validating insurance just insurance information and nothing else about the patient that they don't need to know. They don't need to see that the patient has been in the hospital for depression or is on these certain drugs or has any sort of clinical condition. That particular person only needs to see insurance. And when we start showing people how you can use BPM to orchestrate tasks and limit that what people see and make it very precise to their job role, that technical challenge becomes a lot easier for people. So that would be my answer to that. Ed, if you want to add anything, feel free.
Yeah, I just want to reaffirm something. You know, it's been a mystery to me before I met Mark, and I think to Mark also, about why BPM hadn't had greater penetration in the healthcare world, because healthcare is driven by processes, clinical processes and business processes. It just seems so logical, but there's been almost zero penetration, and I think a big reason for that is the privacy and security issue. People are justifiably highly concerned about privacy and security, and it's only been recently, and partially through some of the innovations that Mark has put in place here, that we've been able to connect up the secure elements with the workflow elements. Thanks.
Hey, Ed, I want to add one more thing on that too. You bring up a great point. Healthcare compared to other industries is very late to the game in terms of going electronic. So the industry has been highly concerned with doing that in the last 4 or 5 years as BPM software has really become prime time. So I think there's been a little bit of it's just too much, too overwhelming. Many of the other industries that we see in like financial services and oil and gas and whatever went electronic several decades ago. Healthcare didn't. And so it's now time that most people are on electronic health records, that this technology, I think, is at the right place at the right time.
Thanks very much, Mark. Okay, so the next question, this is a very specific use case, the case study that you presented. Any other ideas on how this patient management framework could be extended to other healthcare use cases?
This is Ed. I'll take that one. And let me just say that if we just started to list the potential other use cases, we would be out of time and would be going on for a couple more hours. There are so many processes in the healthcare industry that are ripe for this type of automation. It's really incredible to me. And for example, because of the way that healthcare reimbursement is being changed, there are things, Mark and I talked with an organization that has a packaged joint replacement therapy program. They get paid by the government and the insurance companies X amount of dollars for doing a hip replacement. And right now, the management of that whole process is manual, and there are opportunities where patients and actions that need to be taken can fall through the cracks. And there are also activities that occur outside of the healthcare system, of the particular system that's being reimbursed for this service, that the people that are responsible for managing these patients don't know about. For example, if a patient got admitted to an emergency department in a hospital in a town a few miles away. And so by implementing this type of process along with the event notification, event catching processes that Mark described, we feel that we can really significantly help that organization. And there are many, many other stories, again, driven by the new economics of the American healthcare system. Mark, do you have anything to add to that?
Yeah, Ed, I always have something to add to what you say. So we finally have a lineup here of payment, the way people get paid, and long-running processes. So in Ed's example of joint replacement, people in that example used to come in and get your knee replaced. The hospital would bill the insurance payer, and they would discharge you. Good luck, right? I hope everything works out, and they would get paid. And then if you had a problem with that joint and you came back to the hospital could bill again for that problem, right? Every time they did a service on you, they got paid for it. So they weren't incented to think about long-running processes, which BPM is all about. Now, payment reform with the Affordable Care Act is changing that. We're right in the middle of it. And so now that particular client is financially at risk for that patient for 90 days after discharge. So if they do a great job with the joint replacement and that patient doesn't have any problems, great. But if that patient a couple days later has to have a correction or something like that, the hospital has to pay for that. So now they really care what happens for several weeks after. but they're discharging that patient out to a group of providers that they have no control over. They don't control the schedule and the timing of the physical therapists and the drivers and everyone who has to make sure that patient is taken care of. So they really need a way to orchestrate a bunch of people in a federated system together, and they're finally now being compensated properly for that.
Thank you both for that. Okay, so the next question that we have is, I think it's asking for a little bit more detail. The business process modeling and management of IT data system interaction is impressive. This is from audience member Ron Falkley. He's interested in learning more about not just the BPM tool, but about the underlying methodology and level of effort to identify the as-is and to-be business processes and the associated governance.
Mark, do you want me to take a stab at that, and then I'll pass it over to you again? This seems to work pretty well. I didn't mention this, but I'm a trained industrial engineer, and of course in industry we look at processes that are occurring maybe in manufacturing where we're creating or manufacturing a widget. We look at the time involved, we look at the people involved, we look at the equipment involved, and we document that in terms of the current state. And then we look at where the highest costs, where the biggest delays occur, and we look at ways that we can target those elements of the workflow in order to make improvements. So as I mentioned, the healthcare business is full of these opportunities, but some are a higher priority than others for various reasons. So it's important to work, if possible, at the senior level of the organization to identify what the organization's priorities are, what their biggest problems are, and what the costs are that are involved with the various sub-processes. And then we dive into those and talk with the people that are actually executing the processes, document that, come back to our team of executives as well as technicians to identify ways that we might make improvements. And then fortunately, one of the beauties of the BEAT program and the Bonita Sauce implementation is that we can start out with some pretty small elements of the process and still make significant improvements, and then evolve the new process, the new automated process from there. So the key is really to identify where the biggest opportunities are for reduction of delays and reduction in costs, and as the couple of examples that we've said, a reduction in either financial penalties or increases in revenue. Mark, do you want to add to that?
No, that was excellent, Ed. Thank you.
This is the first. You sure you don't have anything to say? Just joking.
Okay. Well,
okay, are there additional?
I guess if Ron Falkley would like further information, he can follow up with you guys after the webinar as well, and perhaps discuss this in greater length.
Yes, and again, this is a topic that both Mark and I would, love to talk more about. There are a lot of techniques that can be applied here, and a lot of opportunities, as we said.
Okay. Fantastic. Ron, contact details should be on the screen, so if you wanted to reach out, and they will be happy to discuss it further. We do have a few more questions. We've got still a bit of time, so if anybody does have any other questions they would like to ask, please enter those into the chat box. The next question is, all of the components look like they're tightly packaged. What if an organization already has some components such as Rules Engine or BPM Suite in place? Is it easy to swap out a component?
It's an interesting question. I'm surprised to see that someone thinks that everything's tightly packaged. It's actually quite not tightly packaged. It's our connectors are meant to be very simple, API connectors, so that we don't, the BPM system doesn't necessarily have a lot of knowledge about the components it's connecting to at all. And that's kind of one of the power of it. It's kind of neutral, and it doesn't have to be deeply knowledgeable Whether if it's connecting to a SQL database, it doesn't really know much about it. It can just ship back and forth, SQL statements, or if it's connecting to an API, it can manage through REST or web services. So it's actually not deeply knowledgeable about any other systems, and we kind of like that because if Bonita BPM came with like a preference of like, well, we really like and we're deeply connected with Oracle, or we're deeply connected with this rules engine or whatnot, that would actually be a downside for us. So in some cases, in some ways, it makes it hard to kind of explain the BPM system because it is so agnostic. But once you get used to that feeling and seeing a long, big list of connectors that you can choose from that all operate with fundamentally the same thought process, then it makes you very confident that, hey, whatever system you bring to me, even if it's a fax machine or whatever, I have a method and a thought process of how to get my process developers knowing how to make a simple connection to them.
Yeah, and Mark, it's Mac. Let me jump in on something real quick there. I mean, that's one of the Bonita Sauce philosophies around technology. I mean, it goes back to our sort of our open roots, and I'd say the only thing that's really requires any standard within Bonita BPM is the use of business process management notation, or BPMN. One of our strong feelings is most of the world has systems in place, has technology systems in place, has process systems in place, has process methodologies in place. That should not be disrupted because of your choice of a business process management suite. You should be able to connect to the systems that are already in place and working for your organization. You should be able to transition processes that may be manual or through different methodologies directly into the business process management system, and then connect those out to data sources, other systems, other people. And so I think there's two sides of the BPM world, those that Mark sort of spoke to that have preference for other technologies or other methodologies, and those like Bonita Sauce that are really agnostic. And both work for different organizations, and depending on what you're really trying to do. But I think in the case of Beat and in other use cases, it's a modern API-driven world, and you've got to be able to connect to what's already in place. You can't really empower an organization if you're requiring to do a rip and replace on a really big technology.
And Mac, I think that's an excellent point. I just want to add to that. This is Ed. And that is, in the healthcare world, in spite of everything we said about manual systems, there are automated systems. Most doctors' offices have a medical record system, which is going to be different than most hospitals, which also have a medical record system. And there are other knowledge bases, clinical decision support tools, in addition to Tacoma, the tool that Mark described. And so I think one of the really highly innovative things that Mark has done with Beat, in utilizing the capabilities of Bonita Sauce, is to build connectors to the secure text messaging system, connectors to the doctor's office medical record system, connectors to the hospital medical record system. These are all something that is daily work for Bonita Sauce, but in the healthcare industry, it's not really been done before, so it's highly innovative.
Yeah, thanks, Ed. And I put up a slide, in case you're interested, that is a little more detailed about the Encounter toolkit and shows all the different tools that we brought together for this health information exchange platform. And Bonita really is our I put it at the top here because it really orchestrates the connections between a lot of these different tools. And we have connectors to almost all of these in some way, shape, or form to help you leverage these for doing health information exchange.
That slide is available to the audience along with the rest of the presentation, should they want it, right?
Right.
Could you make that
yes.
slide available to people if they need that? Perfect. Okay.
Absolutely. I'll include it in the document.
Okay. I don't think we've got any more time for questions. So if anybody does have any further questions, the contact details were up on the screen. You can, and are again, thank you. You can reach out to them directly, or you can reach out to us, and we will certainly make the introduction. All that's left is for me to thank Mac, Mark, and Ed. Guys, that was a fantastic presentation, and thank you for taking your time to thoroughly and comprehensively answer the questions as well. I hope you
you.
enjoyed yourselves.
Yes, thanks very much, Craig.
And also thanks to the audience as well. Thank you to everyone who attended. That's all for today's BPM Open House. Join us again tomorrow for our final day, where we will have 2 new presentations and case studies, and one of our presenters will also be giving away a $250 American Express gift card. So it'll be the same time again tomorrow, 11 a.m. Eastern. In the meantime, don't forget to that for additional white papers, podcasts, webinars, and more, log on to www.pexnetwork.com. Thank you very much, and I will see you tomorrow.